This is April from Complete Health Dentistry. I'm here today with Dr. Mike Rogers to discuss your oral health, gum disease, and proper home care. Good morning, Dr. Rogers.
Good morning, April. How are you today?
I'm doing well. So, Dr. Rogers, what can you tell us about gum disease?
Let's start very simply with what is healthy gums. Healthy gums are nice, pink, healthy things that don't bleed. You brush, you floss, you toothpick, you eat, you chew. Your gums just don't bleed. People who smoke or chew tobacco are less likely to have bleeding gums. Also, some medications can cause the gums not to bleed as well. And so just because your gums don't bleed, it doesn't necessarily mean you don't have gum disease. What gum disease is a culmination of your body's response to the bacteria that are in our mouth. And as we talked a couple episodes ago, we can look specifically in your mouth at what the bacteria are. We can look at them on a microscope slide on a TV screen now and evaluate that and even test for it. So healthy gums don't bleed, no matter what you do.
So what's the big deal if my gums do bleed? Isn't it just limited to my mouth?
No, April, it really isn't. What it does is more and more medical studies right now are coming out showing that gum disease leads to heart disease, leads to diabetes, stroke, cancer, digestive issues, respiratory problems. I mean, you name it. If you Googled gum disease and some disease, you're going to find links not only in dental journals, but now more specifically, major medical journals are starting to come out with more and more studies on this. And it shows that it's not just limited to our mouth anymore.
So, Dr. Rogers, what's the root cause of gum disease? No pun intended, of course.
Well, ultimately, April, the root cause of all gum disease is the bacteria in our mouth. People look at plaque, people look at tartar as causing the problem. It's not so much, it's our body's response to the bacteria and the side effects of that bacteria itself. And what I mean by side effects is the toxins that they produce and how our body responds to it. And our body's response is what dictates if we've got gingivitis or periodontitis or periodontal, more severe periodontal disease.
So how do I know if I have this bacteria in my mouth?
Well, there too, that's a great question. And what it is we can test for it. We can look at it under a microscope in our office. We do that routinely with all our patients. And then there's laboratory tests that we can actually send out to a lab and test specifically, because more and more studies, once again, in medicine is showing that there's links between specific bacteria in our mouth, heart disease and strokes, diabetes, cancers, digestive issues.
Well, so you talked about gingivitis and periodontal disease. What's the difference between them?
Well, gingivitis, both diseases for the most part are non-painful. They don't hurt until it's already gone too far and you start to have problems arising from that. But gingivitis is totally reversible. And one of the things, and I want to stress that, there is no bone changes, meaning your bone and your gums haven't started to erode away or melt away is one term to look at. So your bone is still solid, your teeth are still solid, it hasn't affected anything under, it's just your gums are swollen. As it progresses further down the line and we start to lose bone, that's where we start to get into the different degrees of periodontal or gum disease.
Thank you, Dr. Rogers. March 20th is World Oral Health Day, and in recognition of this day, we are spending the show talking about your oral health, gum disease, and proper home care. When we come back, we'll continue our discussion, and at the end of the show, we're going to update you on our Complete Health Butterfly, Christine Lewis, and where we're at with her treatment.
Complete Health Dentistry, transforming your health for a lifetime.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers at Complete Health Dentistry of Northeastern Pennsylvania. We believe your mouth is the gateway to overall health. Complete dental health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health Dentistry with Dr. Rogers. I'm April, and we're here with Dr. Rogers discussing oral health, gum disease, and proper home care. So, Dr. Rogers, can we talk a little more about the bacteria?
Sure, I'd love to. Bacteria in our mouths, everybody should have bacteria in your mouth. There's bacteria in our mouth that our bodies can tolerate and handle and doesn't really elicit or create a response, an inflammatory response or a body response. And that's so in that respect, we're not going to have bleeding gums. We're not going to have inflammation. We're not going to have problems with the bone and such. Where it does come is the bacteria that we've acquired throughout our lives that create this bacterial problem and causes the bone to erode. If I can, let me try and draw a picture, paint a picture here of what it is. The amount of surface of gums that touch our teeth is about the equivalent of the palm of your hand. So when we as dental professionals look in and we start poking around and looking and the gums are bleeding, it's the equivalent of a bleeding wound on the size of the palm of your hand. So we get concerned. We're concerned because we know all this bacteria is going right into your bloodstream. It's creating these heart problems, stroke problems, diabetes issues, and it's contributing to all this systemic problem, meaning a total body issue. From there, if you went to a physician and said, or the emergency room and said, I have this bleeding wound the size of the palm of my hand somewhere on my body, they'd be extremely concerned because that's infected. That's infected and they need to be addressed. It need to be scraped away or cleaned out or something. But through the years, somewhere in our psyche, we've gotten in our heads that it's okay to bleed in our mouths because that's normal. It always did that, or it always does that, or it's because we're poking at your gums. But as I said earlier, your gums shouldn't bleed regardless if we're cleaning them, you're cleaning them, we're measuring the gums and stuff like that.
So it's never normal to have bleeding gums?
Never, ever normal. It would be like brushing your hair and having your scalp bleed. That's not normal either.
Well, how do I know if I have gum disease?
Well, one thing would be, do your gums bleed when you brush your floss or toothpick, as we talked about? Are they red and swollen and puffy? Do they look more red or are they nice coral pink? Have your gums pulled away from the teeth? Do you see black areas between your gums and teeth? Do you have a bad breath? Does your wife say, hey, Jimmy, go see the dentist, get that stinky breath away? But things like that. Pus between your teeth, if you see that, that's a big warning sign. If your teeth are loosening or they're spreading apart from each other, more warning signs. A change in how your teeth fit together. They just don't feel stable, or you kind of have to fit them back in together. Or a change in how your partials or dentures fit. Those are signs that hey, you've got a problem or could have a problem with your gums.
So what if I have some of these symptoms, but I don't want to go to the dentist?
You know, it's one of those things you have to come in. We deal with patients on a regular basis that are timid or have anxiety with coming into our office. So we have ways to help you. We do use essential oils in our office to relax and soothe. We have different types of anesthetics and things that we can do to make your treatments comfortable, such as nitrous oxide, things like that. So we can help with the emotional aspect of coming into the office or the anxiety of coming into the office.
So couldn't I just up my home care? Can I just brush more?
It's a great question, but brushing more is going to clean some of the plaque, the soft deposits away, but it's not going to clean down below the gum line where this bacteria lives. And also, if you've got tartar buildup, brushing alone isn't going to remove the hard built-up tartar. And that tartar, along with the pores in the tartar and the pores in your gums, is what houses all this bacteria. So unless you get down, remove the tartar, and are able to eliminate the bacteria that have already created homes in your gums, there's no way just brushing alone or just ramping up the home care on its own without having professional help is going to take care of this.
So what do you do then at your dental office that I can't do at home to get rid of this bacteria?
There too, a lot of our pretty much all of our treatments are non-surgical, and what I mean by that is we do it without cutting or removing tissue for the most part. We've got techniques now that can address gum problems and bacterial issues without having to do surgery. So it starts with a good thorough cleaning, a good exam, and then a good thorough cleaning to start to eliminate the bacteria and the tartar, the houses where they live. And then there's from ultrasonic, meaning high intensity vibrating, water spraying and medication spraying units, to lasers, to at-home treatments that we work with on our patients. So, I mean, there's so many things that we've got available to us now that's non-invasive and non-aggressive that we can certainly address all these issues and help your body heal and not have to fight this.
So is this something I can just come in your office and you take the bacteria out and then I'm good to go?
No, it's a combination. To just scraping this stuff off, as I was just saying before, is just going to remove some of the bacteria. It's not removing it all, because that bacteria is now embedded into your gums.
So how many times do I have to come in?
Everybody is different. Everybody has different problems. Everybody has a different condition. So in our office, we treat every person individually. So what we do is we look at your condition and your set of circumstances, and how can we maximize your treatment so that it fits into your lifestyle or your way of living.
So do I have to come in once a week, once a month, once a year?
Great question, April. Everybody is different, as we talked about earlier. For example, it depends on the severity of the bacterial infection. So with all those little creepy crawly things going around in your mouth, it could be initially maybe a couple weeks at a time, 2-3 weeks, and then over a period of months, 3 months, 6 months. Everybody is different, so it's hard to say if it's a specific thing, but we tailor it specifically to you and what you need.
Thank you, Doctor. When we come back, we're going to talk about what our listeners can do at home to prevent gum disease. The days are getting longer, the snow is finally melting, and now it's time for a good spring cleaning. At Complete Health Dentistry of Northeastern PA, Dr. Rogers reminds you that a professional dental cleaning is imperative to your overall health. Did you know that 8 out of 10 people have gum disease? 50% of all heart attacks are linked to gum disease, as well as stroke, diabetes, Alzheimer's, pancreatic cancer, arthritis, and pregnancy complications. At Complete Health Dentistry, you will receive many life-saving screenings to keep you in tip-top shape and decrease these potential medical complications. We want our patients to enjoy a long, healthy life with minimal medical issues. Regular dental visits will help you maintain healthy teeth and gums and help prevent serious health conditions. Take time for your health. Call 253-5000 and schedule your spring cleaning today.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back. We are here with Dr. Mike Rogers talking about oral health, gum disease, and proper home care. So, Dr. Rogers, you talked about the bacteria in your mouth and how to take care of that with your gums and your teeth. But what about patients that don't have any teeth, patients that have dentures? Would they still have the bacteria?
Yes, they would, April. That's a really great question. Patients with dentures still have bacteria. I mean, even though it's a hard plastic, it's still porous, so the bacteria live inside those pores, just like we were talking earlier, the tartar buildup. And you can get tartar buildup on dentures. It does happen because that's just the plaque buildup is turning over into tartar. So if there's plaque buildup, if there's bacteria in the mouth, you should really have your dentures professionally cleaned at least once a year to clean and disinfect them. You should have an oral cancer screen we had talked about ill-fitting dentures or improper fitting dentures as being a cause or a culprit for oral cancer. So once again, coming in annually, even though you don't have teeth, can eliminate a whole host of problems. Cancer, it can eliminate bacterial issues. It can address things before they get worse.
Okay, so patients with dentures do need to see the dentist.
Yes, they do.
All right. Well, what can our listeners do at home to prevent gum disease?
That's a very broad question, and
Well,
try and limit
can you
it.
just start by telling us a little about maybe the options out there for toothbrushes, toothpaste, floss, things like that for home care?
Awesome, I will. The thing with let's start with toothbrushes. You want to have a toothbrush that's going to fit. You don't want one so big that you can't reach all the areas of your mouth. You don't want one so small that's just going to take you twice as long because you're not going to reach all the surfaces. So you want the right size. There are out on the market all kinds of electric brushes, Sonicares, Oral-B rotary brushes, things like that. I do see a benefit to them in all patients. Years ago, we limited it to just people who had difficulty using their hands, but now the technology is such that it really does clean so much better than we can do with just a toothbrush alone.
So with the toothbrush, if I don't have an electric one, there's so many different bristles out there, soft, hard. What do you recommend as far as that?
Well, what I recommend is a soft bristle brush, because once you start to get, even though it doesn't, if you are using a hard bristle to start with and you transition over to a soft bristles are going to be less traumatic to the soft tissue, meaning the gums, and that's what we're trying to protect here. And then hard bristle brushes can traumatize the gums, cause them to recede quicker. It could do damage to the teeth themselves as well. And so we don't want to see that happen. So a soft bristle brush that's comfortable in your hands and can reach all areas of your mouth.
Okay, so with your toothbrush also, how often should you change that?
That's a great question there as well. When you start to see the bristles fray or splay out, then you really should have them changed. There is, you don't want to keep it for months and months and months, 3 months maximum, and then you should eliminate it as well. The other is if you're sick or you've been in contact with people who are sick or there too, you want to eliminate that, because that toothbrush is holding the wee beasties, the wiggly things that we were just talking about eliminating, and you can re-inoculate or re-put those bacteria back in your mouth.
Oh, gross. I never even thought of that. So when you're sick, throw out your toothbrush. Okay.
Well, after you're sick.
Oh, okay, got it. What about toothpaste? There's so many different. When I go to buy toothpaste, I just stand there staring at the shelves. There's just so many out there.
There too, great question. And once again, it all depends what you're looking to do. There's toothpaste to desensitize teeth. Now, what I'm recommending here is if you've got sensitive teeth and you're just saying, I'm going to take a toothpaste and start with that to eliminate the sensitivity, that may be all you need. But on the flip side, it could be an underlying cause for something more significant that we'll talk in future about. But you just don't want to assume it's a sensitive tooth issue, and it could be more problematic. So be seen by a dentist to evaluate that. But there's whitening toothpaste. There's toothpaste to gum health. There's toothpastes that, as I said, can eliminate sensitivity, but also a lot of the more aggressive toothpaste can actually make your teeth more sensitive. So the whitening toothpaste, the ultra super duper whitening ones, can actually make your teeth more sensitive to hot, cold, sweet, sour, things like that.
Well, what about floss? How often should I floss? And there's different types of floss. What do you recommend there?
Well, I recommend flossing at least once a day. The more you do it, the more stuff you're removing from in between your teeth, the less you're feeding those bacteria that's in between the teeth, potentially causing gum and bone problems, tooth loss, and all of that. But more specifically, now we're heading into helping you stay healthy long term, preventing other medical issues.
So now that we're armed with the appropriate toothbrush, toothpaste, floss, can you give us, our listeners, some tips on using these tools to get their mouth healthy?
Brush every day, at least twice a day. for 2 minutes. That's really what it is. And a lot of the electric toothbrushes now have 2-minute timers built right into them. Small circular motions, scrub every surface of every tooth to eliminate plaque and bacteria. Floss at least once a day, as we talked about. If you've got real tight contacts, you may want to go with a waxed floss to make it easier to snap in and out between. You need to get up underneath your bridge work. If you've got permanent fixed bridge, there's things that can help you get there. Eat a healthy diet, eliminate or modify how much sugar intake you have. Visit your dentist at least twice a year, and manage dry mouth. You got to eliminate the dry mouth that can happen.
What does dry mouth have to do with gum disease?
Well, there too, it's medications that we use and alcohol that we can drink or whatever can decrease the amount of saliva that we have. And when the saliva decrease, it actually allows the bacteria to be more aggressive. So they're going to work much more at damaging your teeth and your gums and getting into your bloodstream that much more aggressively.
What about rinses? I know there's a lot of mouthwashes out there. What are your recommendations for that?
Well, once again, rinses are a great adjunct to everything that we've just talked about. There's antibacterial rinses. That are very technique sensitive and can be very caustic to your gums if you don't follow the directions on them. And then there's other rinses that sound great, pre-brushing rinses and things like that really haven't been proven by the ADA to do what it actually says. There's fluoride rinses to help strengthen the enamel and eliminate or decrease the bacteria content as well. So once again, getting a good conversation going with your dentist and what's best for me is really the best way to go about it.
Dr. Rogers, any final words?
So even if your oral hygiene routine is perfect, textbook, and you don't have the bleeding gums and such going on, you still need to come in, you still need to be seen. Professional cleanings regularly is the best way to keep you and your overall health going.
Okay, if it's been a while since you've been to a dentist, call our office, 570-253-5000 to schedule your appointment. And now it's time to check in with our Complete Health Butterfly, Christine Lewis. Here's Adam and Dr. Rogers to discuss that.
Hi, Dr. Rogers. Good morning.
Good morning, Adam. How are you today?
Very good. So the Complete Health Transformation Contest winner is Christine Lewis.
Correct.
And she's now undergoing a 6-month complete health transformation under the care of you and several other Pennsylvania-based professionals.
Correct. It's not so much just a cosmetic makeover like most extreme makeovers are. What we're looking at is how we can change her health span over the course of her entire life. So we've got to take her where she's at, educate her on how to become healthy, how to stay healthy, and how to keep this going for the rest of her life.
So the process has begun, and she's all in. She's all in. She's full tilt on this, and that's great to see. So I'd like to sort of check in a little bit about, where she's going with this and some of the stuff that's already happened. Now, it is World Oral Health Day coming up on March 20th. So I know that a big component of this transformation is at Complete Health Dentistry. So has she been into the office yet?
Yes, she has. We did our complete comprehensive initial exam, where we sat her down, went through all her x-rays, her photos, we checked her gums and discussed the bacteria that we found in the office. And from there, we've created a treatment plan to start.
So there's sort of 3 big facets to her treatment plan at your office. Is that right?
Correct.
And what are those?
First, we look at foundation, getting the gums healthy, eliminating plaque, bacteria, tartar, all of that, and making sure the bone and the gums are stable and healthy.
So she had some bacteria there, yeah?
She did, and one of the things, she hasn't been to a dentist in many years because of a fear. So she's been afraid to go to the dentist, more from the unknown, and we were able to address that fear. We use warm neck wraps. We make her comfortable. We've got essential oils, soothing blends, and things like that we could diffuse in the office to help patients that are fearful. A
little nervous or fearful.
Exactly.
And your bedside manner is pretty good too, Doc.
Well, thank you.
So good. So you're able to sort of allay the fear and get into that first step, getting her gums healthy. What's the second step on the path?
The second step is then we're going to address tooth issues such as broken fillings, abscessed teeth, and such like that, just to correct the damage that has been done through the years.
But the first step is to actually build up the base that those teeth are living in, the gums, right?
Correct. It's like, I liken it to building a house. You need a good solid foundation. Then once you have the foundation, you can start from the ground up and work. And that's what we're in the process of doing. The other thing we did was we not only checked her bacteria in our office using a microscope, but then what we did was we did a salivary exam where we send it out. We haven't gotten the results back from the lab to find out what bacteria we're actually fighting in Christine.
So an even more detailed look at the bacteria. You actually ship this out to a lab which analyzes it.
Correct. And what's neat about it is Dr. Whitney, who's looking at her medically and inflammation-wise, will use that diagnostic tool as well, because he uses that to deal with what he's doing systemically.
So it's a team approach to this woman's health. It's really cool. So then what's the so there's three steps on the path: the healthy gums, that's the foundation, then getting the teeth back in order, and then what's that third step?
Third is cosmetics, aesthetics, and tooth replacement.
Aha.
And we're going to eventually get there. But the first things are first. You put one foot in front of the other. You
do the groundwork first, and that makes it possible to build up a beautiful smile on top of that groundwork.
Correct.
So now, what's the timeline here for Christine? It's only been a few weeks that she's been sort of undergoing this process. She's in it for a total of about 6 months. Is that right?
It's 6 months, and that's really what we're going to wind up doing. It's not a sprint; it's a marathon. So we've got to go at a nice pace that not only doesn't overwhelm her, but we've also got to take into the fact that with our treatments in our office, it's a lifestyle change from not just now, but for the rest of her life, because people hear brushing and flossing. Brushing and flossing will remove plaque and some of the bacteria, but it's not going to eliminate the bacteria that we're looking at that causes systemic problems.
So in the last, as we wrap up the show here, how can we get those gums healthy? What are the methods we use?
Well, we've got multiple options. We not only clean the teeth, what we use in our office, we call it adaptive periodontal therapy. And what it is, it's a combination of removing the plaque, removing the tartar, removing the bacteria, training and teaching the patient how to keep that bacteria down, and helping them eliminate them at home.
Well, thank you so much, Dr. Rogers. Good luck, Christine. It's great to be checking in and hearing how she's doing. Keep listening to Complete Health with Dr. Mike Rogers every week here on the radio and hear Christine's progress. Thank you so much, Dr. Rogers.
Thank you, Adam. Have a great day.
Complete Health Dentistry, transforming your health for a lifetime.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers at Complete Health Dentistry of Northeastern Pennsylvania. Complete Dental Health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Transforming your health for a lifetime.
Hi, this is Dr. Mike Rogers. Thank you for joining us today. I want to extend a warm welcome to our practice and just invite everybody who's concerned about their overall health. And if you want to be tip-top and total health, come on into our office. One of the big things that we have with oral cancer right now is just the significance of it and how it is growing. So give the office a call, 253-5000. We're here for you.
Complete Health Dentistry.